Well, chemotherapy also damages the immune system, doesn't it?
In some cases it does. There are some chemos that actually can boost natural killer cell activity. So it's not completely damaging to the immune system. But some are. And, so you definitely would need a test to determine how it's functioning and do some things along with it. And everything I use, I've read all the studies that I can find to see if there's any possible negative interaction that they know of between the natural and the chemo. And I know enough about how chemo works and how it's broken down by the liver. Very carefully select herbs and nutritional supplements that don't have an effect on the liver's breakdown of those chemos. That's something that oncologists will warn patients of all the time. They say don't take any herbs with chemotherapy because it could interfere. And they scare people into that. Well, there's plenty of herbs that have been studied with chemo that have been shown to make it work better, and they don't interfere in a negative way. So, yes, there are herbs that do interfere, and you need to see an expert like a naturopathic doctor who knows about those interactions to give you an expert's opinion on how to combine the two. Don't rely on your own reading on the internet or anything like that. And you can't rely on the oncologist because most of them are not trained in herbal and natural medicine. They have a very limited knowledge of it, so they can't even advise you. A lot of people say, well, maybe I should just wait and take the supplements after the chemo is finished. But you find out, when is the chemo going to be finished? Unfortunately, sometimes it never stops until they found the cancer has progressed, and then they move you to a different chemo. There's never an opportunity where you're not on chemo sometimes, or a long enough period of time. I look at it, when you combine natural medicines with chemotherapy, if you pick the right ones based on what the research is showing, you can take a chemo that is minimally effective and make it maximally effective.
Wow, so you can actually boost the chemo.
Make it work better without increasing side effects. I had testicular cancer, same cancer that Lance Armstrong has.
Right.
That happens to be one type of cancer that can be cured by chemotherapy. You can take it, chemo, and it actually kills almost every single cancer cell. And what's left, hopefully, the immune system takes care of, and it often doesn't come back. Testicular cancer is one of the most sensitive cancers to chemotherapy, where there's plenty of other cancers, unfortunately, they're not so sensitive. Some are very resistant right from the start, like pancreatic cancer or sarcomas, and even prostate cancer is extremely resistant to chemotherapy. Then there's some that are sensitive initially, like breast cancer, but then slowly get resistant the more you have the chemo. And so you need to look at why is testicular cancer so sensitive to chemo and others, pancreatic cancer isn't. It's kind of back, like a survival of the fittest analogy.
Have you discovered why that's true?
Oh, there's all kinds of research done on why that is true. Pancreatic cancer cells and other types of cancers, they have all these mechanisms to protect themselves from chemotherapy. And they flaunt those mechanisms to basically overcome the chemo. So it only reduces it. It doesn't get rid of it. But keep this in mind. Natural medicines, various natural medicines, can prevent those resistance mechanisms from taking place, or at least reduce them to allow this chemo to then work like it's working against testicular cancer cells or lymphoma cells. So I can just outline a few. You hear most chemotherapies go after dividing cancer cells. A cancer cell has to be dividing for a majority of chemotherapies in order to kill them, to kill the cancer cells. But most of the research shows that sometimes 90% of the cancer cells, 80% are dormant. They're not dividing.
So it doesn't help with them at all?
It doesn't help with them. A cancer cell has to be in a dividing state for most of the chemotherapies to have an effect. Not all of them, but most. And that's why they give you multiple doses of chemotherapy. However, even that, these cells may still stay dormant and happen to come out of their dormant state when the chemo isn't even in your body anymore. There's no way that they can predict the cancer cells if they're dormant or not when they give you the chemo. And so they give it to you, they wait a week, 3 weeks, give you another dose, hoping that some more dormant cells went into a dividing state when they gave you the second dose. But there is a natural substance called arginine that has been studied in England in breast cancer patients, and it showed that when they combined it with chemo, it helped the cancer cells go in more synchronized fashion into a dividing state, and then they gave chemo.
So that the chemo was then effective.
More effective that way, and they found increased complete response rates with that, better responses. But it's very timed properly. You don't just take arginine at any time. It was given a few days before, and the cells went from the dormant state into this dividing state. Now, that sounds scary, but they're going to do that anyway. They're just not going to do that when the chemo goes in your body. They're going to do it at any time they feel like it. So the arginine simply takes them and pushes them into that state right before the chemotherapy does it. And the research shows that it increases the response to chemo. Fortunately, that was one study, placebo-controlled study, done in, I think it was in the late 90s, and they never did a follow-up. It's a supplement. There's not a lot of money in it, unfortunately, and that's kind of where it's been. But I use arginine all the time, and I've seen nothing but encouraging results.
Of the results that you have had very few people who have not had remission.
I have people that I've had some people that have a great response and go into remission. I have a lot of people, however, that the cancer seems to stabilize, whereas before it was progressing. So I'm not, curing people of cancer. I wouldn't say that. I feel I'm helping them live longer until there are better therapies out there, better natural therapies, better drug therapies. I'm keeping them staying nice and healthy for as long as possible, because I have patients come in that they do have cancer in their bones or other places in their body, and I check their immune system. I give them things to try to correct their immune system. That's one piece. They're on chemotherapy. I'll put them on various natural substances, try to make that chemo work better. And what I've seen in that aspect is I've seen people where the chemo was no longer working, and they're running out of choices. We're running out of choices, and the doctor's going to switch them, or they say there's nothing else. We add these things, and all of a sudden things start to turn around, or they have better responses than what's predicted for them.
Now, when this happens, do the doctors call you and ask what you're doing, or do they seem not as interested as you would like?
Unfortunately, no, they're not as interested as I would like. I communicate all. I'm in Massachusetts, and it's pretty conservative, and some are interested, but often too busy to follow up. But they're often excited. Stay on those things. Just stay on those things.
Do they ever ask what those things are?
Not really. They just say, just keep with that. It looks good, So that's kind of how it goes. And
does it make you crazy?
I send them a correspondence. It does. If I saw another doctor gain results on things that I haven't seen those kind of results, I would want to call them up right away. I'd be very curious. And I don't see that, unfortunately, with most conventional doctors. I send them all the research. I send them letters describing exactly what I'm doing for the patient. They can see themselves, how it's benefiting. But very few respond to that, unfortunately. But that's not what's important. What's important that is helping people. Well, that's what I'm all about, and that's what drives me to do this and to search. I don't give up on any patient. If they want to continue fighting, I'm going to fight with them and try to get their other doctors involved with me. But I'm going at this with a sledgehammer and, as much as I can. And I know a person is very beat down from chemo and weakened, and I try to boost their spirits and keep their fighting attitude, and then the results reflect that and keep a person going. Seeing that, this supplement and this supplement are really making a difference. And the labs help that, too, because if you're taking 5 or 6 different products and you don't know if they're doing anything, you can see things are better maybe on a CAT scan or the cancer hasn't progressed, but you're wondering, do I have to take all 5 of these products? The labs can help you see how each one of those products is making a difference for you, because you can track them.